I am Dr. Steve Sinatra at Healthy Directions.
And I'm Dr. Drew Sinatra.
And we're going to talk about women and heart disease and heart health in general. You know, the heart of a woman is different than a man's. First of all, they're smaller. So the architecture of a woman's heart puts her behind the eight ball, so to speak.
Some women come into my practice with hypertension or high blood pressure. Others don't even know it. So they don't know it until I take their blood pressure and it's really high, and then we have a whole conversation about high blood pressure.
High blood pressure in women is the most serious risk factor. So when I see a non-smoking woman in my practice who has high blood pressure, I really focus on cardiovascular risk.
When I'm treating a woman with high blood pressure, 3 things I like to do include making sure she's eating the right foods. Number 2 would be exercise. And number 3 would be looking at other factors in her life that could be contributing to the hypertension. And if it is something like stress, we want to really work on that and address that.
A lot of doctors focus more on male issues when it comes to heart issues. I realize that when it comes to heart health in a woman, I have to be much more aggressive. When I see a woman with heart issues, sometimes it's much harder to diagnose. The symptoms are different. The risk is different.
For the women in my practice, their top heart health concerns include obesity or being overweight, hypertension or high blood pressure, and fatigue.
So how do I summarize a talk like this? When it comes to a woman, I like her to check in with her doctors, go over the risk factors. But basically what she needs to do is really work with her doctor and look at her risk and really get that, she is a candidate for heart disease. Because that denial, I think, is the biggest Achilles heel in women, thinking that she's not a candidate because she is a woman.